Good afternoon. It is a real pleasure to be here. So we're going to talk about overactive bladder as well as frequent urination in general. So you can think of it that way also. But we will speak about what are the symptoms, what causes an overactive bladder, what is the typical evaluation that a urologist will do for this, as well as all of the treatment options that are out there for this condition. So overactive bladder is diagnosed purely based on symptoms. There is not a diagnostic test or a study that will determine whether you have this. It's purely based on the symptoms that you report. And the three main symptoms that will be reported for overactive bladder are frequency, urgency, as well as urge incontinence. What is frequency? A lot of people will say, oh, do you go to the bathroom frequently? And if I was a patient, I would say, well, I don't know. What is frequent? And typically, the normal bladder will hold about 450 to 500 cc's of urine. And so this will allow you to urinate on average about every 4 to 6 hours. So in general, if you're urinating more than 8 times per day, that's considered frequent. Urgency. This is a sudden urge to urinate, possibly even when your bladder isn't full, possibly when you just urinated. And a lot of times this will be associated with some incontinence, urge incontinence. So the word incontinence means leakage of urine. And urge incontinence is when you can't get to the bathroom in time and you leak urine on your way to the bathroom. And this is different than stress incontinence. A lot of people will have women in particular maybe will have stress incontinence, meaning they leak urine when they cough and sneeze or put stress on the abdomen, exercise, etc. That is different than urge incontinence, which when you can't get to the bathroom on time. This is extremely common, and symptoms will occur in a significant portion of men and women as they age. But it's important to know that this is not a normal part of aging, which I think is the problem or the holdup of keeping patients from going to see a doctor for this. You just assume this is a normal part of aging, nothing I can do about it. Nobody wants to hear about it. I tell my primary care, they don't really say or do anything, and this is just how I'm going to live for the rest of my life. But I'm here to tell you this is not normal, and there is treatment for this. Affects both men and women. The difference here is that a man has a prostate, and that adds an additional layer of complexity that I'll talk about. This condition is not going to kill you. This is purely a quality of life issue. There are some circumstances that can lead to significant health conditions associated with bladder symptoms, but in general, this is just going to affect your quality of life. Maybe before you came in, you went and looked for the closest bathroom. Maybe you're exercising less. For example, when I was pregnant, I stopped walking the Katy Trail because I don't know why in the heck the Katy Trail does not have a single restroom, but I could not get all the way down and back without having to urinate urgently, and it was leading me to nearly wet my pants. So something like that. It may limit other activities, even coming to things like this. If you feel like you need to urinate every 20 or 30 minutes and you're afraid you're going to have an accident, maybe you change travel plans because of this. Or maybe, like me, you really want to sit by the window, but every flight you take, you sit by the aisle because you're afraid that you're going to have to disturb people on the plane to get up to urinate. So there's all sorts of ways that this would affect your quality of life, but you may not know or think this is something that can be improved. So to talk about urination, I just wanted to show you a basic picture of the bladder anatomy. So the tubes at the top, the two yellow tubes, on the left is male, on the right is female. The two yellow tubes drain urine from your kidneys. So your kidneys filter blood and the waste goes into your urine. So remember that. The waste goes into your urine and into your bladder of the things that you eat and drink. If you have a normal heart and normal kidneys, if you excessively drink, your kidneys will get rid of that excessive fluid so that you don't become puffy or turn into a marshmallow man, and will filter all that excessive fluid through down to your bladder. So around the bladder, in both man and woman, is muscle. It's called the detrusor muscle. That's how the bladder squeezes. When you're not ready to urinate, at the bottom there, you'll see the urethral sphincter. You'll voluntarily contract your urethral sphincter and you won't contract your detrusor muscle. This is how you store urine until you're ready to eliminate. On the left, you'll notice the prostate. This is important. This is very important for men, especially as men age. This prostate I'm showing you is around your urethra. So if your prostate gets enlarged in time, which that's called BPH, benign prostatic hyperplasia, extremely common in men as they age, it'll put pressure and impinge on the urethra right here. And this will make more sense later when we're talking about this, but a woman does not have a prostate, but this can cause a lot of problems with emptying your bladder and storage symptoms, similar to overactive bladder that we'll talk about. I also wanted to show you this confusing slide to show the complex pathway of the storage and elimination of urine. It seems very simple to us, but the sensation of your bladder being full passes through your spinal cord and your brain and then back down to your bladder, to the muscle, to allow you to contract the skeletal muscle to empty your bladder. This is a very complex and coordinated process that also requires you to then relax your external sphincter, contract the muscle, and urinate. If you think back when we were babies, you were walking around or crawling around with your diaper on, and you had no idea that you were urinating. So when we're infants or babies, we have a reflexive bladder, meaning when the bladder is full, you don't have to think or voluntarily do anything. The bladder will contract and the urine will be eliminated into the diaper. But when we go through potty training, we're first learning how to coordinate this process. It's how we learn to sense for the first time our bladder is full. How this sensation goes through the sensory fibers to our brain. We tell our brain, hey, we're not ready to pee. We no longer want to pee our diaper. We want to hold it and go do things in life. And later, I want to eliminate my bladder when I'm ready. So this process happens during potty trained and becomes more sophisticated in time, as you guys know. But this can be disrupted later in life, leading to overactive bladder symptoms, which is the point of this talk.